It's likely something called commotio cordis, which is something that occurs often in sports when the front of the chest is hit at the exact precise place at the exact time in the cardiac cycle to cause the heart to stop beating effectively. And oftentimes patients can die if there's not CPR or an AED in place right away.
NFL Buffalo Bills safety Damar Hamlin collapsing on the field, suffering a cardiac arrest after tackling a Bengals player in the first quarter. Here with more on a potential medical cause is Dr. Frita Fisher. Good morning, Dr. Fisher.
Good morning.
Good morning. What do you think happened here? Is this a heart condition, or is this he was hit too hard in the chest?
This is horrifying is what it is. And it does look like, now that it's been confirmed, that he had cardiac arrest, that he got hit in the chest in really the most unlucky fashion. It's likely something called commotio cordis, which is something that occurs often in sports when the front of the chest is hit at the exact precise place at the exact time in the cardiac cycle to cause the heart to stop beating effectively. It causes an arrhythmia. So the heart is moving, but it's moving in a fibrillated fashion where you cannot get blood or oxygen to the brain, to the body. You pass out, and oftentimes patients can die if there's not CPR or an AED in place right away.
Well, thank goodness they brought him back to life. CPR for about 9 minutes, we're hearing, and then the defibrillator saved his life. What are the effects of someone's body after going through that?
The effects can really be detrimental. When the body goes without oxygen, you can get organ failure. You can have problems with the brain, an anoxic brain injury. You can get kidney failure. And I am a nephrologist, a kidney doctor, and I see this from people who have a lack of oxygen or have abnormal heart rhythms. You can also get liver failure, and patients can die. The important thing with CPR and having that automated external defibrillator is that it has to be done quickly, because every 1 minute of a delay from being shocked is a 10% decrease in the survival.
So, Dr. Fisher, if it's him being hit hard, the commotio cordis, and if you were his doctor, would you recommend that he plays again if he does recover and comes out of this?
It's actually a bit premature to say, because he is a 24-year-old among the healthiest in the world, these football players. And we are doing a lot of speculation, but we don't know his exact condition. Yes, we know he has a breathing tube in. Yes, we know he's in critical condition. But for any patient who gets cardiac arrest, we want them to be put into a medically induced coma. We put the breathing tube in them to protect them. We sedate them so they don't work. And so it's too premature to say, but certainly football is one of these sports. I have 2 children, a female and a male, who play football, and it's very difficult for football to ever be a safe sport. We can only try to make it safer.
I know, and our hearts go out to his parents. His mom was in the ambulance with him. You're a mom, I'm a mom. I can't imagine what she's going through too. We're offering up prayers. Thank you so much, Dr. Fisher.